Good afternoon, everybody. This is Michael Bracy welcoming you to the May 29th edition of Music Cities Together Live. Music Cities Together Live is a presentation of the Music Policy Forum and Sound Music Cities. We are thrilled that you are spending some of your Friday with us. We know you have a lot to do with your day and have a lot going on in your lives, your personal lives and your work lives. And we really appreciate all the feedback and all of the encouragement to keep the show going. We started this program in March with a commitment to do it through the end of May, as long as people found it valuable and useful. It seems like people are liking it, which I appreciate. And so we're going to keep on rolling for, again, until it seems like it's run its course. But as of now, every Friday at 2 p.m. Eastern, we're going to be joining you with a new set of guests and new topics that are all focused on the question of how music organizations, musicians, public officials, researchers, and others are navigating both the short-term crisis that is connected to the global pandemic, and also how the short-term crisis intersects with the broader work that we all have been doing for a long time around music and music ecosystems and the structures of the music community. Today we've got a fairly spectacular set of guests, fairly spectacular. We have a spectacular set of guests who are doing remarkably meaningful work all across the United States at the intersection of music and healthcare and access to health services for musicians in the music community. Before we bring in our guests, I want to give a couple of quick updates and kind of news and notes. First, I want to make sure that all of you have access to our YouTube page, where we're archiving the previous programs. After today's show, we'll have up to, I think, over 25 guests from, I think, 22 different cities have joined us since March. So if you have not been able to see some of those or be interested in going back and looking at some of those events, we certainly would encourage you to do so. So Alex, our producer, is putting that link in the chat if anybody wants to go find our YouTube page. Two other pieces, well, actually three other pieces of news. One, a quick update on the Reopen Every Venue Safely initiative that is being run by Music Cities Together. We've talked about that over the last couple of weeks. It's a project that we are extraordinarily proud of, where we are working with pilot cities in the United States to help support working groups focused on the issue of how do we reopen venues as quickly and as safely as possible, and then how do we communicate the realities of what's happening in our venues to our music workers and to our audiences. We're thrilled to announce that Denver has formally joined as our 11th U.S. pilot city, so now we have 11 pilots that are hard at work and will be focusing on the development of the Revs pilot programs as we go throughout the summer. Also, some exciting news out of Toronto. Alex is going to put a link up into the chat. Some breaking news overnight of a major initiative, a major victory in Toronto, where the City Council has agreed to a major tax benefit, essentially, or tax reduction for music venues. I believe it's a 50% reduction in taxes for certain qualifying venues. So again, a huge shout out to all of our Toronto friends and neighbors, including Mike Tanner and many of the other awesome people there who've been working to make this happen. But this is a significant victory for venues in Toronto that could be a model for other cities, and we look forward to kind of seeing the details of that proposal or that initiative and what that could mean for others. And finally, I want to bring in an unscheduled guest, Marian Lombardi from Washington, D.C. Marian is with us today, and she joined us in one of our earlier programs and talked about some of the initiatives taking place in D.C. Marian, you've got some updates. Let's see if I can bring you in here. Are you with us, Marian?
I am, yeah.
There you are. Hey, thank you for joining us. I know when we had you on a couple, I think 6 weeks ago, you talked about some of the things that the district was looking to do on behalf of musicians and creatives, and I think you've got a great piece of news I'd love for you to share with the audience today.
Oh, yeah, thank you, Michael. So we're just sharing that we have actually launched our Care for Creatives program, which is a mental health support program, which pairs any creative who may need support with a counselor who is there to support them. It's a very simple model. It's a partnership with George Washington University and their counseling program and their counseling center. And it's really very basic, but we're super excited about it. We have launched it, and we'll be doing a much more formal a press release pretty soon. But we already have creatives who are taking advantage of it. So it's really great. The counselors are starting to see creatives, and the creatives are starting to reach out. The challenge in all of these things is we can communicate about it as much as we can, but we also need the creatives to be willing to ask for help. And so I think that we're trying to market it and share it in a very different way than we would have other programs. We are really taking a very personal approach to it, and really doing one by one, reaching out to people. I mean, yes, we will do a press release and all of that, but we want to make a sustained effort to actually talk to people personally and have our ambassadors and networks talk to their friends and neighbors personally, because it isn't, it's a personal thing. It's a personal, but we want people to feel safe enough that they can really ask for help, and want them to know that there are people there that will help them. So
Yes.
We're pretty excited about that.
That's so great, Marian. Congratulations and thanks. I know you worked with a lot of people in DC who obviously this was not just your doing. There are a lot of people conceive of this program and making it happen. Alex, if you could put in the chat, there's an email address that DC area creatives I think can reach out to in case they would like services. And again, there'll be more of a formal announcement. You said later this week, is that, or early next week?
Well, the process has to run up through the chain. So it may take a minute, but it'll get there.
All right, so we'll look for that in 2022. Marian, thank you for joining us, and again, keep up the great work in DC.
Thank you so much, Michael.
Yep, great. So now we're going to turn to today's main topic, which again is an extension of what Marian was addressing, which is issues related to musicians in healthcare. And we're going to talk about this in a couple of contexts. Clearly, for those of you who work in the music community, you know well too well that access to healthcare is a structural concern that has been around since the beginning of the music industry. I mean, it's been there forever, and it's certainly something in my previous life at the Future Music Coalition, we spent a lot of our time and resources on, especially before Obamacare was passed, just in terms of how do you help musicians navigate this unbelievably complicated web of decisions to understand what are the best things they can do for them and their families. There was some hope that the Affordable Care Act was going to be transformative. We'll talk with our guests today to get their sense on what the status is now. But really what we're going to focus on, beyond just what's happening right now with the shutdown is we're going to talk about where do our advocate colleagues want to see the field going? What are the issues that we need to be thinking about as we start to get move beyond this crisis, in the next period of time? So we're hoping to be joined by a really awesome human being and advocate named Peter Grant, who I think is having trouble navigating the Zoom link. So I don't think Peter's going to be able to join us as we had hoped at the outset. But I want to give a shout out to a conference that Peter organized earlier this year, and Alex will put the link into the event into the chat. But basically, it was a summit meeting that took place right before the shutdown and the COVID crisis really accelerated. But it brought together dozens of public officials, of advocates, of local nonprofits from different aspects of the music community to Washington, D.C., to basically get a sense of the state of the union of what is happening with musicians in healthcare. And all of these videos from this event have been archived, they're available. So I definitely encourage you to go do a deep dive and explore, kind of what's out there. And big congratulations to Peter and the whole team who kind of put that event together, because it really was a remarkable gathering of some leading thinkers. And part of what's so challenging about healthcare, of course, and again, for our international guests, welcome to American Dysfunction 101. Our healthcare system is extraordinarily complicated and disconnected and broken. And I think we all know that. And as a result, a number of organizations have emerged on a local basis that are nonprofits that basically provide resources and support for local musicians, local creatives, and there are a number of these across the country that do exemplary work. Rini Collins from HAAM in Austin was hoping to join us today. I don't believe Rini's going to make it, but a huge shout out to the work that they're doing in Austin, Texas. But We're going to talk really focus on two advocates and two people doing really interesting work. Erika Dudas with the New Orleans Music Assistance Foundation. Yes? Did I get it right? And Denise Burnside with SMASH in Seattle. So Erika, let's start with you. Welcome. Thank you for joining us today.
Thank you so much. My name is Erika Dudas. I'm the managing director of the New Orleans Musicians Assistance Foundation. Our largest and most well-known program is the New Orleans Musicians Clinic, which was founded in 1998. We provide direct healthcare services through our own brick and mortar clinic. And then our Assistance Foundation expands the efforts of that mission to keep music alive by providing a lot of community health opportunities, a lot of navigation work, and you know, a lot of gap filling for musicians who are trying to access healthcare. So I don't know if you wanted me to go into.
So the New Orleans creative community, for those who haven't had a chance to spend time down there, is one, I mean, you know, obviously a unique community, but it's also a remarkably diverse community in terms of types of artists, types of experiences, intergenerational work. I mean, there's just a lot going on there. And I'd love you to talk a little bit more about like who, like you don't have a typical client, but what are some examples of the types of people that you resource and what are the types of support that they tend to need?
Right. So, I mean, I think an important leading point on this is the lack of access that's present in Louisiana as a whole. Like, I think context really matters. And New Orleans is being a part of a statewide dysfunction when it comes to providing healthcare to the working poor is kind of where we jump off. And then you have the additional challenges of musicians and artists and culture bearers who are self-employed contractors. So before the Affordable Care Act, it was very difficult to be insured. Louisiana held off on expanding Medicaid, although we have expanded Medicaid now. So I just kind of pulled a report. I mean, statistically, about 45% of our patient population is male. 34%, 34% are what's considered elderly, so over the age of 63. 51% are African American. And then the way that that breaks down is that we serve musicians of all types. That's about 75% of our patient base. And then we have about 15% in this category that we call cultural bearers. Mm-hmm. So this would be like Mardi Gras Indians, music composers, cultural photographers. We really open our services to anyone who keeps New Orleans culture alive. So that can mean a lot of different things to a lot of different people. But then a new and emergent population of our clinic has been dancers. We did a lot of pre-COVID days, we did a lot of face-to-face interaction and community event around dancer wellness, especially in the burlesque and traditional African cultural dancers. So they're a small percentage right now, but we expect for them to gain traction. They're at 3% right now. So the types of services that we provide would be anything from when we intake them into the clinic. You know, a lot of artists don't realize that they're eligible for Medicaid. So we're able to get them one-on-one with the social worker to determine what subsidies they can take part of, whether it's applying them for SNAP, Medicaid, anything that they're, or there's a hospital system down here at University, which used to be part of a larger charity hospital system that expands the services available to uninsured people. So if they have an emergency, they can go to that hospital and they'll have a discounted bill or free based on where their income qualifies them. So they start off having that conversation with our social worker. She gets them into our system so that they can start getting medical appointments. That's an important step, especially for us, which is a hurricane-prone area, so that all of our patients have their medical records right on their phone if they so choose through a portal. And then from there, we offer primary services through a full-time family nurse practitioner who will see anybody. Medicaid patients don't pay a copay. Everybody else pays $10, even if you're uninsured. And then from there, we're within this larger system of LSU Healthcare Network. So there's 16 different departments of subspecialties just within that network. And the copay for that would be if the patient is carrying insurance, whatever that insurance deems the copay to be, or $25 if they're uninsured. And then the work of our foundation is to cover the rest of that cost for the patient. And then, in doing this work, we have a lot of partners who own independent practices and say, I want to be involved, and therapists in particular, or this group of individuals and healers who want to help our patients. So we're able, as a nonprofit, to pivot outside of the medical system that we're working with to develop independent contracts with these providers and basically pay or supplement the cost of that visit for the patient. So on the medical side, that's kind of an overview of the services that we provide. And then, through our community health agency and through the Assistance Foundation, we're able to give a little bit, like a lot more tools to the medical staff. So we have a full-time emergency fund that we've had since 2007. This emergency fund, so if a patient is experiencing a time of medical emergency, we can pay their rent for a month or give them a grocery gift card or keep their lights on, because we recognize that we can't tell people to go out and gig if they're going through chemotherapy or addiction services. And then the other work of our foundation are kind of like these special projects. So all year I host different types of community engagement. During the enrollment period, we'll host musicians to play a concert and then have navigators lined up to consult with people about their insurance options to get them on board. And then they can become a patient of our clinic right there in the field if they want to, but we're just there to help them get connected to any source of healthcare. We are partnering through 504 Health Net, which it's after Katrina, there was a lot of focus on rebuilding community clinics in New Orleans so that everyone had a neighborhood clinic that they could visit. So, we're a partnership in that. And so we're able to navigate that and help patients get appointments there if they don't want to, or if it's not convenient to use our system. In the fall, we always do a flu shot drive for service industry and musicians who are not a part of our clinic. If you're a part of our clinic, you'll get it at the clinic, but if you want it in the field, we'll give it to you then. Sometimes that aligns with navigation, so that's good. And then, do you want to talk about how any of that has changed post-COVID?
Let's kind of pivot a little bit, and I think one of the sort of the ugly truths that we've seen in this disaster, there are a couple of pieces of it. One is, the whole concept behind social determinants of health has been brought to the center, and that people who are economically vulnerable or pre-existing health conditions or other factors have been, hit harder, by the crisis. And, I think when we couple, sort of that understanding of the systemic economic vulnerability of many of New Orleans' leading creators and members of the music and cultural community, and then the sort of tragic analyses that seem to be coming out that said if we had had a federal response 1 or 2 weeks earlier, this would have been mitigated potentially in a way that could have, had an impact around Mardi Gras and around different things that we just didn't know was happening. And so I don't know if you can speak to just sort of the sense, you all got hit really, you have been hit hard, you're still being hit hard, but just of like your community and your clients and just the overall frustration about just, again, the systemic failures across the board of how we're responding to this thing.
Yeah, I think I feel the same as a lot of different healthcare organizations on this thread, that our patients are in the bullseye for this disease. So, for this outbreak. So not only are they public facing individuals and individuals whose work exists in like a risk area, 64% of our patients manage 2 or more chronic diseases. So, it's a very, that's the population that we're working with. And I think that in the early days of COVID, it was kind of a mess to get a test. Mm-hmm. I helped a couple of musicians get a test at the community drives. And if they weren't presenting with symptoms right away, they would be turned away for tests because it was so limited. And by not having those tests available, a lot of lives were lost and a lot of people got sick for no reason. So I definitely share in the frustration of the government response. But I would like to say, like, for New Orleans, our mayor has been keeping people in. And that was one of the first things that we decided as an organization too, is that we would try to keep people in their houses as much as possible. And so one of the things that's attractive about us as a partner is that we don't have to open up a food bank, but we have vetted lists of who our elders are in our community. So the first things that we did, we have 3 different food sourcing projects right now that get food to those musicians who need it, and healthy food. So I think I think it's important to know where these community members are in the process of COVID-19 and how we can best be helpful and useful at this point. For us, it's making sure that we disseminate factual information, making sure that we find a way to disseminate that factual information that is not internet-based was like a big thing that, we did first off. So we started by creating these fact sheets that we would disseminate at all food banks that we could ask to partner with, because we figured that the cultural community of New Orleans is so interwoven to our fabric that getting this information out so that even if people saw it and they handed it to, an elder or took it for themselves, that they would have the information. They don't have to sift through the internet for, information on COVID symptoms, COVID and diabetics, COVID and asthma, how to make the most of your telehealth appointment, because that's been a big shift at our clinic, is that everything went to telehealth pretty quickly. So how do you navigate that for people who are used to in-person and at our clinic, very personal experiences with our family nurse practitioner? I also want to mention that my team I don't think there's one member of my team who hasn't been on board for at least 5 years. Most of us are more at 10, and our family nurse practitioner has been there for 15 years. So having an experienced team that deals with this level of need on the regular has been really helpful in a response, because we don't have to create anything new. We're already in this place where we're able to respond appropriately to this health disaster. And I think the economic fallout, I just always try and redirect people. The economic fallout is bad, but it originates from a place of public health.
And I think that's one of the reasons we're, so thankful that New Orleans is one of our leading Revs pilot cities, and that you're deeply engaged in those conversations, because we need to make sure that as we're going through the process of figuring out what reopening looks like and how we're going to do it again safely and how we're going to do it as quickly as we can, we really have to understand that our musicians, I don't mean to say they need to be protected as if they're passive, but that there needs to be advocacy around, again, what is the reality of their experience. And playing music and touring is extraordinarily draining. It's very physical. I mean, there's just a lot of aspects to it. So we're going to talk about that with Martine in just a few minutes. So Erika, thank you so much for your perspective. Alex put the website up in the chat, and we certainly encourage you attendees to go to their homepage, go to the resource guide that they've put together, and thanks for everything you guys do. So I want to bring in Denise Burnside from Smash in Seattle. Denise, welcome. Thanks for joining us.
Hi, thanks for having me.
Yeah, so Seattle, I mean, it's interesting because I think at Smash, you've got some commonalities, you've got some differences in terms of what is happening in New Orleans. Why don't you talk a little bit about what Smash does? And really, again, the starting point that I always like is, let's just pretend COVID didn't exist. Let's just say, what were you doing? What were you planning on doing? Kind of what is your vision and your role, more broadly?
Yes. First of all, Erika, really inspired by what your organization is doing. Holy wow, that's a lot. And so SMASH is Seattle Musicians' Access to Sustainable Healthcare, and it was founded in 2015. And so it was a 100% volunteer organization until just recently, until mid-2019, when a part-time staffer was hired, and then myself as the executive director and Megan Tucker as the program manager were just hired on February 24th. So literally right before all this hit the fan. Yeah. So SMASH's focus starting up was really around preventative healthcare and around doing hearing clinics. Because it was, volunteer driven, so there were limited amount of work that could be done because of all the hard work that was put in by the founding members and the board. So with Seattle, as we're not unlike other cities, but our economy and our cost of living is really, really high. It got expensive really quick. People got pushed out of affordable living in the downtown sector, got pushed out of Capitol Hill, other artistic neighborhoods, and really continue to get pushed out of Seattle because of the costs. And healthcare tends to be one of the last thing that people want to fund. I mean, I think healthcare is an area that there's not a lot of trust because people, when you do spend time and effort and money, sometimes the result isn't that great. People don't have always great experiences when they interact with the healthcare system. So in Seattle, our, kind of some of our focus is really about preservation of our music scene, because we saw what happened in San Francisco. We saw that without the care of the artists and the venues, it will disappear. And Seattle is heading in that direction. And there's a lot going on in Seattle around trying to figure this problem out, and SMASH is there to help musicians out health-wise. Mm-hmm. So in the past, the focus was, as I said, preventative care. We're partnered with a number of clinics, both on the homeopathic side and just on the Western medicine side. So you kind of choose what track you want to go to, and we partner with these clinics, and either with their sliding scale that they approve people's costs for healthcare, then we subsidize those costs by paying for services. We run twice a year. We're running a hearing protection clinic, which was really popular and inspired by HAAM. They've been doing this for a very long time, and we partnered with the University of Washington to do an audiology clinic, in which the hearing is tested. They're given information on where their hearing is currently at, where their strengths and their weaknesses are, and then they're fitted for molded earplugs. And they're also given choices about the different levels of plugs that go into their earplugs. So, the amount of dB levels that you're protected from, so it's easier whether you're playing live music or you're going out to see music, you might use different ones. So last year a dentist clinic came on, and that has been extremely popular because even folks with insurance might not have any dental care. So that has been amazing. Lions Creek Dental is the clinic in Seattle in which we partner with. And during COVID, they offered emergency dental as well to do pre-screenings. But we are slowly working towards opening back up. So we will be able to offer regular dental cleanings and repair and maintenance once that's opened back up. Last year also did an acupuncture clinic, but that was at the end of the year. And so obviously that hasn't been continuing right now. When COVID hit, all of our services became obsolete because only critical care was being addressed. So within a matter of weeks, we launched new services. We had planned on launching mental health care in the fall, and we ended up launching it at the beginning of April. We partnered with 2 different organizations to offer mental health services. We partnered with ReachLink. They're actually out of Florida, but they are run by folks that were in the music industry and have a lot of connections with the music industry. And they can do, we are funding a minimum of 8 virtual 45-minute sessions with a therapist through them. And we also partnered with Tour Support, which is a great organization, and it's national, who serves both musicians and touring professionals. But they were offering 1-month subscription to BetterHelp, and they offered to extend those services to our members. So we've been enrolling folks through Tour Support for subscription to BetterHelp, which has been fantastic.
Yes.
So, yeah, question?
No, a billion questions, but no, I mean, that's just, and I know from our colleagues in the Seattle region and King County, I mean, just how much they value and appreciate what the organization's been doing, both locally and then being a national connector and trying to feed in with other organizations. So it's again, the cohort model is something that we're really a big believer in terms of not everybody reinventing the wheel, but trying to build off of each other's successes and challenges while valuing and celebrating the fact that everybody has different community needs and different dynamics. So it's a tricky, kind of a tricky thing to navigate. So as we think about reopening, I mean, again, Seattle is, the whole Revs project really started, with Kate Becker in Seattle and King County and Dow, and just the whole notion again of trying to really engage it with the public health community in terms of what are the mechanics of this and how are we going to do it in a way that feels right and safe for musicians, for venue workers, for audiences, and how do we communicate that? And what is your perspective? I mean, I think, again, not to simplify what is a much more complicated scenario, but it feels like many communities are maybe dealing with more pressure in terms of the locality and the state maybe not being on the same page, maybe a sense of premature opening, maybe pressure to kind of get things going before we have the science. King County has a reputation of giving the public health leadership team, really control over some of the staging. Has that made a difference, do you think, in terms of how the Seattle music community is kind of thinking about reopening, in terms of having a sense that science might be dictating this more than politics? Or is that
I mean, we definitely, I think a lot of people feel that, both Dow Constantine with Kate Becker and her amazing work, and Jay Inslee as our governor, letting science dictate more than politics. We definitely have had political upheavals about when we should be open and what should be open. But right now, King County our numbers aren't low enough to qualify to go into the second phase. So I'm also a co-owner of the Clock Out Lounge, which is a smaller local music venue. We mainly do local music, plus we do drag shows and comedy, karaoke, etc. Great little venue, but so kind of in the thick of figuring out all that reopening. We're also a restaurant bar, so we're allowed to open in phase 2, and it's we've got a great team, and everyone's being really thoughtful about how to keep people safe, because the last thing that we want is to do the thing where connection to community, connection to each other is what we're all about, and to think that if we invite people in and all we do is get each other sick, then we lose community members, and that's really the last thing that we want to do. So, and obviously, SMASH would be there to help anyone that did get sick, but that's SMASH obviously is there because we want people to be healthy. So everything that we think about constantly is the preventative health and how to keep people healthy. So then when they are sick or suffering from anxiety or depression, that we're there for them.
Yeah. And I've got one kind of last question, and it's maybe not a fair question, so you can just punt if you don't like it, or you can just say whatever you want to say. But I mean, I think, for a lot of us, this is a moment where we obviously are hyper-focused on the immediate pragmatic realities of what we're dealing with and what we have control over and where we need to engage. But we also are trying to be visionary and say, what does success look like? What does it look like? And if somehow our community comes together, and if there's significant change in this country, again, not political change per se, but if things are very different from a standpoint of an organization like SMASH, like what does it mean for SMASH not to be necessary anymore? Or what would be a version of SMASH where everything else, some of the crisis things you're dealing with don't have to be, are dealt with through other structures? I mean, do you have a sense of what that could look like?
Well, I think the first thing that I would go back to, kind of when you had the opening statements, you spoke about how difficult our healthcare system is, and even being able to navigate it. And Erika brought up that a lot of folks don't even know what they qualify for. So what I see for the future of SMASH is adding on a social worker for the navigation purposes of it. So SMASH itself can be an organization that both connects people to healthcare that they qualify for, to help fund the the difference between what they qualify for and what the payments would be for them, so they can actually feel like they can go to the doctor on a repeated basis and get the healthcare that they need, and find what they need. I personally have had really bad experiences with the healthcare system, and being in the music industry for, I don't know, 20, 30 years, I'm old. It's an ongoing theme. It is never, no matter the state of the healthcare system, it has never been easy to navigate. And speaking with some other folks in the healthcare industry, just the fact that the health insurance companies themselves purposefully don't make it easy for you to get information from them, because they've got limits on their calls that they're supposed to take to give you any information, and they just push you to go find it yourself online, and it's all really difficult. And so I see us as being the organization that ensures musicians are healthy. And I know we're not the only scene, but we've lost a lot of musicians to, drug addiction, to suicide, to, basically just lack of resources for self-care. Yeah. And I don't see that going away just because the healthcare system might improve.
Well, Denise, thank you so much for your work and your work of your colleagues at SMASH. And again, Alex put the link to the website and also to the Clock Out Lounge, which I want to come visit next time I get to come to Seattle. I look forward to that. So you guys are doing amazing work. And again, on the structural piece, I want to give a shout out. Peter Grant was able to join us, and we're running short on time. So Peter, we're not going to be able to actually bring you in via video, but to reiterate what we said earlier, the ability to convene the local organizations to then have the national power to inform the federal policy debate is so critical. And you need to have the boots on the ground who are dealing with individuals who then can really understand what the dynamics are that need to be fixed and what's not working. And it's really so important, again, to do that hyper local, but then also the broader cohort. And I'm going to, Rini Collins, I think you were able to join. I think Reenie had a board meeting that ran late, and so she is hopefully still here. Reenie, are you with us? Let's see.
Yes, I'm here.
Hey, welcome. So Denise, thank you for all your work. And Reenie, we're running a little bit late, but I wanted to bring you in and let you say hi real quick and make sure that you know how much we appreciate and value the work you're doing at HAAM. Would you mind just doing a real quick 90 seconds on HAAM and how you guys are doing in Austin, and just sort of what the what the headlines are for what's going on right now in your
Sure. And Michael, thanks for doing this. And Peter, thanks for getting everybody together in the first place, a couple of months ago. I think it's a really exciting thing for our nation, and certainly nothing more timely. Our whole music community has been decimated, and the work that our organizations do is more vital than ever. HAAM is probably no different than anybody else. We're all still figuring out and reeling and trying to figure out, what we need to be doing as an organization in the right now and what we need to be doing to survive. I think you probably all know our model. A lot of what Denise was talking about is based on our model. We are in the process of evaluating kind of where we think Austin is. Of course, because South by was canceled so close to COVID, it was really extra disastrous for the music community here, because so much of our music community counts on, 2 or 3 or 4 months of income during that 2-week period or 3-week period. HAAM is probably looking at about $1 million loss in revenues and donations so far. And we are looking at ways to write grants and try to get partnerships to make that up. And I think probably the biggest thing that I would say is our message has been to our city leaders and our hospital leaders and our healthcare leaders is we've tried to keep messaging in on the value that HAAM brings to our community, because we support these 2,600 musicians with over $12 million of value in healthcare a year. If they don't have HAAM, they're going to be at risk and be back in a system with nothing. Right. And then we've been driving home again the economic impact that music and live music has on Austin and how critical it is. And so hopefully our city and some of the funds that have come in, we're hopefully lobbying to get some of those funds towards live music and towards musicians.
No, thank you, Rini. That's so great. And Alex has put the link, into so people can go to the website
Sure.
and learn more about
And I apologize so much for being late.
Oh, no, it totally happens. And no, we so value your leadership. And, again, not to be a broken record, but it's just so, important to see the kind of organic, locally based, locally rooted, nonprofit infrastructure that has grown up around all these different subsegments of the music ecology, and how then, again, they grow in power by inspiring other organizations, by supporting, artists and our music workers. And ideally, collectively, we're all working towards a better future, that we hopefully have agency over what that looks like, and that's why we all do this work, is like we can engage in the moment, and we can also say we need better, and how do we, again, get from here to there. So Rini, we'll bring you back for a longer conversation at your convenience, but if you can hang on for a minute, we've got a previous HAAM beneficiary, Martin Perna, is with us, and there you are. Martin is joining us from Oakland. For those of you who don't know Martin, he is a musician, he's a composer, he's an educator, he's an activist. He is a global citizen who has basically lived the Music Cities conversation for the last couple decades, living in Brooklyn, living in Austin, now living in the Bay Area. He has seen firsthand what it means to be a music city and what cities can do to be in support of their community or not. Martin, why don't you just quickly tell your story about how HAAM came to your assistance a couple years ago?
Hi, everybody. Denise, Peter, Alex, Erika, Reenie, Michael, thanks for having me here. I was living in Austin after moving down there from New York in, the end of 2005 to 2012. And that was one of the reasons why I moved there, because New York was a dangerous place. I had been living on like $200 a month, or a rent that was $200 a month, like a tiny room, my money under a futon, and working as a bike messenger when I wasn't doing music. And I was just constantly worried. I stopped doing all these things that were healthy to me because I was worried that I would get hurt. And I didn't want that to happen anymore. But I didn't have money for healthcare. I think it represents to get on any kind of a plan when you don't have a big employer, represents such a huge part of an artistic worker's income. So that was one of the big draws, that, and I had some music friends down there. Shout out to all the Brownout Grupo Fantasma folks. And it was just that security of knowing that I could live and not go out and go bungee jumping every day, but live a normal life. Or if I, fell off a stage or, messed up my back lifting an amp or, anything, that I wouldn't be hit with the worst case scenario. And I didn't expect anybody to sort of pamper me or be able to get, liposuction or anything for free. But like it really came through. There was one time when I was canvassing for Obama in 2008 during the primaries, and I was on a scooter. I got chased by these pit bulls. I smashed into a utility pole and messed up a bunch of my ribs and the scooter. And HAAM helped me, they helped me navigate, go to the ER, we'll help you work it out. And at the end of the day, the bill was maybe $350 compared to, it could have been in the thousands if I was paying full price. They also helped me get great dental care. To this day, it's actually better, the dentist that I had there in Austin, than the dental care that I had through my wife's UC Berkeley healthcare plan. So they did such a good job. It was really supportive. I didn't take advantage of SIMS, which was the sort of affiliated mental health and addiction counseling services, but a lot of people did. And as a musician, I was really proud to be part of the benefits every year. And HAAM was, so many of my friends in Austin are still part of that. And that's really been, a pillar, particularly as the music industry, our means of income has gone down as records, as the sales of physical products have gone down. Streaming doesn't put the same amount of money in our pocket. So we have to go out on the road. And that's a riskier thing. It's something that beats up the body a lot more. Mm-hmm. And these local-based healthcare, kind of beautiful stopgap organizations are so crucial. And you see they become magnets for the cities in which they exist. And we can, I don't know how much has been talked about in the series about just how how many dollars $1 spent on live music represents, but they're part of that, because if you're not healthy, you can't go up on stage. You know, you're not inspired to write songs. You're too busy hooked up to a machine or coughing or, you know, bedridden. So it's really beautiful to see these things happening, these organizations surviving, thriving, and then also pivoting in this moment, being so dynamic, and you know, having the same gift for improvisation as the musicians that they serve. Is a really beautiful thing. But ultimately, it is part of a larger question, just with anything, about paying now or paying later. And prevention is always it's always a better investment than the cure. The same thing goes for housing. You know, it's way more expensive to take somebody off the street and put them back into a house and rebuild a life than it is to keep them in a house all along. And so this is obviously part of a larger question of, like, here we are in late stage capitalism, like everything is falling apart around us. But, you know, I see organizations like this as, you know, firefighters. But then there are also these other systems that are so much bigger than us that are making the fuel and throwing all these obstacles in our way. So I look forward to the moment when we are able to elect more forward-thinking leadership, because ultimately these organizations for touring musicians, they can only help you when you're at home, and we're on the road most of the year, you know, a lot of times in other countries, you know. So if I'm in Australia, like, I buy out of my own pocket, you know, when we go on tour, travel insurance.
Mm-hmm.
Didn't have to do that, but I do, just in case, you know, something happens in another country, and it sets me back a couple of $100 each tour. Like, I'm usually paying like 1 or 2 gigs worth of pay just to make sure that I'm covered. And you know, so it's such a risky thing, but it is. And now navigating the healthcare system, that's another thing that is so crucial. I have a master's degree, and my wife is pregnant right now, and it has been hell trying to deal with Kaiser Permanente and just how little they'll pay, how much they hide things, and try, you know, the insurance companies are part of the problem. So it's such an essential service. I don't know how to keep on saying that. You shouldn't have to do it, but it's there. The only way I see out of it is to have a universal healthcare system, and then private hospitals for rich people who want extras. You know, we deserve that. But until that, every city needs something like this, because without it, the musicians are going to fall through the cracks. And culture bears too. I think that the umbrella needs to be widened. You know, it's not just people on stage, but people who are mixing, people who are doing lighting, because we're all part of this creative team that makes, you know, the spectacle work.
So Martine, I'm going to broaden out a tiny bit, and I'm going to flatter you so you can turn your video off so you don't blush or whatever. But, you know, I think, not to be, you know, pedantic or sanctimonious about this stuff, you know, the people who are involved in today's session, the people who do this work, we do this to be in service to people like you. Because what you bring and what Antibalas brings and what your other musical, you know, outlets bring to us is unspeakable joy and catharsis and empathy. And I have had unbelievable moments, and many of the people, again, who are watching today have had moments, you know, benefiting from your and your colleagues, not just you, but, you know, the creativity of what you bring, you know, to performance, to recordings. And again, Alex has put some links up in the chat to the new Antibalas record, which you all should download on Bandcamp and enjoy that, and some of the other stuff that Martine is involved in. But, you know, we need to keep the focus of this conversation on the role that, like, what are we asking of you? You know, again, not to personalize it, not what is Michael asking of Martine, but what are we as human beings asking from our musicians, especially to help us navigate a time of extraordinary sort of anxiety and grief and mourning, without the ability to have access to the traditional tools that we gravitate towards, especially in communities like New Orleans, you know, to mourn. And then we're putting that on you collectively, not Martine, but collectively on artists to say, okay, we want y'all to figure out how to do some live streaming, and we want y'all to have some sort of super creative presence to help, you know, entertain us and help us process this period. And then, oh, by the way, we want you to go out and start playing live music again and we're not exactly sure what the rules are going to be or if it's going to be safe, but we want you to get back out on the road. And I think that this is all, again, this is why we structured today's conversation, because we wanted to really highlight that we've had structural inequality and structural inadequacies in terms of the relationships between musicians and healthcare, as I said, for decades. And as we move into the next stage of this thing, we need to be really mindful of, like, what are we asking our musicians, and not just the artists themselves, but the crew, the lighting techs, the people who work in venues, the people who work in bars, what are being asked of them, and how do we make sure that they are held up in the front of the conversation in terms of, like, who are the people that we really need to make sure feel like they can sign off on this. And, could you, I know y'all potentially, y'all may have had a bit of the thing, right? When you're finishing up your last tour, is that, you think you may have?
Yeah, we're in an album cycle right now that's been interrupted. We put out a new record, our 7th record in 22 years of being a band, on Daptone label out of Brooklyn, New York, our family label. And we started Florida right around when I heard about the first cases at the end of January was kind of when it hit my radar. And then we did a whole West Coast tour. California, we did 3 days in the Bay Area, had a couple days off, and I stayed at home to do some teaching in the off days, and the band drove in the bus up to Seattle. And during that time, 4 people got really, really sick on the bus. We weren't sure if it was COVID or just a bad flu or a cold, but that was how we rolled, So, we just, it's like 13 people 14 if you include the driver, wiping everything down, sleeping with our curtains closed, all sorts of people had these little essential oil vaporizers, just everything wiped. We went through so many paper towels. It was kind of horrible, but it was scary, being on the road, and then also just playing and knowing, just trying to put every ounce of what we had into being well for the, 120 minutes that we were on stage. Yeah. And not really knowing what we could do, because you can't really stop, when you're on the road. There's all these people depending on you. And that kind of plugs into the economic piece. The reason why you can't stop is because there are so many people, not just depending on you, the fans, but it's like, if the band doesn't show up, then the bartender doesn't get paid. The promoter doesn't get paid. The person who runs the parking lot next to the club doesn't get paid. So artists are an economic engine, but we haven't seen a real increase in pay since 2007, because our expenses have gone up faster. Like, people pay us more as a band in 2019 than they did in 2017, but our expenses, our overhead is that much higher. So now it's hard to imagine, because when I talk to our manager, agent, other club owners, talent buyers, the guarantees, at least for the next couple of years, are pretty much over. So bands are going to have to travel. Like, once we say that things are safe, touring bands are going to show up and not know what they're going to make at all, even if they've been in the game for 20 years and packed that club for the past 20 years. They might get 100. So the amount of risk that we're expected to, and that's before we even talk about the health risks.
Right.
So when people are saying reopen live music, what they're expecting musicians to bear financially, health-wise, it's unreasonable. We were living such a precarious existence before this, that to go back into it, both economically and with regards to health, if there are not standards. So both of those things, the health piece, that these are healthy venues that when we show up and sound check, hang out for the 5 hours between sound check and the gig, and then perform, and then, sell t-shirts, records, meet our fans afterwards, that all of that, there's little to no room for transmission, and whatever risk is there, that we're all on the same page about it, that we're not bringing someone into something that they didn't sign up for. Yep. Nor are we giving anyone false hope that this is like, oh yeah, this room is totally cool, nothing can happen. And right now, as of yesterday, we get together and have these band conversations on Zoom every Thursday. Our musicians are like, hell no, I'm not setting foot in a club right now. Not tomorrow, not next week. I'll play outside, we want to play more than ever. We want to perform, but, at what cost? And so that, that needs to be worked out, and I'm happy to be here, but I think all of those things, outlining from, we show up at a club, a lot of times we're in these places for 14 hours,
Right.
Sometimes if you roll up the night before and your tour bus is outside, they open up at 10 a.m. so you can use the toilets and shower and blah, blah, blah. So sometimes we're at these clubs for 20 hours all around, and a big band is creeping into a corner to find where they can practice. So almost every square, before the show starts, we could potentially be in every square inch of the club,
Right.
And that's a lot to ask. But, for things to reopen, like I'm not going to kill myself to be, people are going to start finding new income, or it's going to privilege certain types of acts. Someone who doesn't sing, a DJ that can wear a mask all night, or instrumental music, or smaller format things, or, what I hope the kind of silver lining is that more local scenes pop up, and different cities figure out what works for them as far as outdoor concerts, what is safe. But I think we're going to see a real reshuffling of everything. And I really hope that we can get back out on the road, because it's heartbreaking. But even the fact that after 20 years, like I'm in West Coast, we got a couple guys West Coast, the guitarist in New Orleans, and then everyone else is in New York. So and there's 12 of us, so we can't even really legally, safely get together to do streaming stuff right now. So that makes it, we're going through that right now too.
So I think, putting aside that it would be cool to see your version of the dead mouse thing. I mean, maybe there's going to be the resurgence of creative mask wearing DJs. That's kind of an interesting thought. But I think, beyond that, just to echo some of what you're saying and what we're hearing in a lot of our Revs conversations as our pilot cities are starting to do their collaborative work. I mean, this notion of transparency and accountability is critical. And again, it's going to be critical for the musicians to have agency in terms of what do they need to see, and they can't be passive in that conversation and just wait to see, all right, what are you saying to us? It's got to be like, no. And we have, I think that there's some precedent in terms of, writers, and this goes well beyond a writer, but in terms of a contract or a document or a sort of, accountability structure that basically says this is what we're expecting. And if you're not providing this, then, and one of our Revs meetings earlier this week, one of our team members has a lot of experience as a tour manager. And he said he's kind of anticipating, the band pulls in and the tour manager is going to be wanting to get, see all the checklists on the venue side, and the venue is going to want to see it from the band side. Like, are they all, kind of meeting what they need to meet in terms of their own health checks and things like that. So this level of collaboration is going to be neat. It's going to be a new level of partnership and collaboration and trust. And then to take it to the next stage. And I know that you're fundamentally, you're an optimistic human being. Obviously, you have to be to survive in the music community. And it's hard to think of an Antibalas, show with dance pods where people can't move outside their 5 feet. And I mean, it's kind of a terrifying thing to think about. And we've had artists in our interview program talk about, like, I don't want to play to a room full of people wearing masks. I mean, there's a lot of things that's hard to kind of get our head around.
Yeah.
But I also think that, again, this is an opportunity to think structurally about, again, the economics of the live music industry and to fundamentally ask these questions, which really aren't up to you to solve. Like, we collectively in the community have to say, is there value for us, for a band like Antibalas to be able to thrive in music at all? I mean, we know there's a market. We know people come to your shows. We know people buy your albums. We know. We also know, even before COVID, it didn't really fit into the economic structures of the community as they were defined. And so we've got to fix that. And that's on us. That's on the collective community to say, what can we do? Where do we have opportunities to rethink the economic relationships, to say, okay, if we want there to be, a 12 or 13 piece, Afrobeat ensemble, that's like blowing people's minds and changing the world, then we've got to figure out what those work, how those work. So anyway, So Martine, just a last kind of closing question, and it's again the impossible question, and you may not have an answer, and so you can punt, and you have every right to punt. But I mean, so again, you mentioned that you and Courtney are expecting. Congratulations! You have life changes ahead. You've got career things happening. You've got a lot on your plate. As you think about the next 6 months, what does that look like, and what are the things that you need to see as a business person, as an artist, as a human being, that are going to make you feel comfortable? What are the benchmarks that you need to see before you even start to think about, getting the machinery geared up again?
Let's see. Wow.
Punt. Thanks.
No. I mean, that was the thing. I hadn't even thought, I was thinking like, we just make the masks or the new concert t-shirt. And part of that is cool, but then I'm like, man, that's why I go on stage, is so I can see people smile.
Right.
And because at least the type of music that we play, there is an emotional feedback loop that happens between us and the audience. And I think most groups worth their salt, and even to anyone who's made comics, that's what we live for. That's what the stage is. And it's this, kind of this invisible ping pong that goes back of joy. And that is literally, you can't see, you hope, and maybe it might lead to new forms of expression. Maybe people become better dancers, or they shake their heads a lot. I don't know. But right, we've been wired as human beings to like this part of our face. A smile is a smile. When people sing along, how can you tell if people are singing back if you can't see their mouths? So I think we're going to be a ways away from it. Personally, as a band, we're trying to just navigate all these new platforms, both for asynchronous communication, like, is it possible to make a really good record when we're not all in the same room? And then for performance stuff, can we pull off this a cappella, like the different multi-frame window stuff? And is that even worth, other than entertaining somebody for 30 seconds and letting them know we're all still alive, like that has nothing to do with what we do. It's to do one of those things really well pulls us away from our core mission.
Yep.
So I think part of it is us figuring out like, where is our time best spent, and then wellness, and then figuring out like, what are we all going to do when unemployment runs out at the end of July? So we're looking at Patreon. We're just getting together, because this is like, there's a lot of stuff that we like, busy work that we could be doing right now to be like, oh yeah, like I've done a YouTube live thing from my studio. That's like a kind of one-man band thing. A couple of us are doing that just to stay creative, to learn the platforms and see whether they could be some way to establish a connection with our fans and at least develop new income streams. But, I know, not speaking for my band per se, but there are certain groups that were really doing, had a lot of momentum, that you will probably never see or hear them again after this. There's probably gonna be a lot of young people who are that come out of this. I mean, that's the thing. It's like a really big fire.
Yes.
And certain kinds of seeds, like the pinole in, it's one of the California pine trees that gives you pine nuts. But those seeds really can only take root after a seriously intense fire. So the optimist in me, music is never going to die. But I think music, as we have come to love and know it, is not going to be the same for a while. And if it is, there's going to be a lot of bad, there's definitely going to be some underground stuff. And like the rebel in me, the pirate radio person in me, is like, fuck yeah, get together and do it, On the other hand, it's like, how many people are going to show up in the ICU 2 weeks after that? Do we really, really want that? And it's a shame that so few of I think we should really look back to the 80s, when AIDS was happening, because part of it was really dangerous, but some people were still out trying to live their best lives. And they're like, there were some bad decisions that were made when people could have, protected themselves better and exposed innocent people. And I don't want to be part of that, period. As a musician, that's not that's completely counter. And I think most musicians are like that. And anybody who's willing to get to the stage really quickly, beware. to talk about positives, I mean, I've seen some, my friends in the band Delhi to Dublin up in Vancouver, they did a really cool drive-in concert. They had these beautiful LED panels behind them. Everybody was in their cars, and it was like 40 or 50 cars. It wasn't a ton. They had some beautiful drone footage. People were so, like, it really touched their heart. So I see stuff like that happening, but those are stopgap measures. Like the future, that's totally not sustainable to have drive-in concerts, you know? So the Zoom things, the drive-in things are cool for right now, to stay up and to let people know we still care about you. We're still creative. We want to share something with you, but nobody can make a living off of that. That's not a livelihood, you know? And nor do we want to go back to venues where they're operating at 30% capacity. In order to make the same amount of money, we got to charge $100 a ticket. Who's going to have that after this? You know, and even with I'm interested in like the lottery systems of maybe everybody pays $2 for a lottery ticket, and somehow the sum of that gives the band what they need, also provides for the club to take care of all of the, you know, check off all the disinfectants and all that stuff. But there also needs to be federal funds to make sure that these buildings that are going to gather people, that are economic engines, that these small club owners, you know, at the clock out is not having to borrow like $200,000 to get a new ventilation system and UV blah, blah, blahs. And, you know, like, but this is, you know, this could be part of the Green New Deal. That's the other thing, is that every venue needs some renovations. You know, the toilet leaks, or there's no toilet, or there's, you know. So again, the optimist in me is like, okay, you know, there's a lot of opportunities to rebuild this in a very new way. Or maybe we just, you know, there's more outdoor concerts that are happening, or this.
Well, Martine, thank you as always. I mean, no, just so always talking with you, and again, you know, your career arc and your, you know, arc as a human being. I mean, just, you've lived through so much of this, and, you know, you've seen Brooklyn, you've seen Austin, you know, you understand music ecosystems better than most. You understand touring. I mean, you know, you've got the big picture. And again, you know, I think all of us, you know, who are participating, you know, in these programs are all focused on what can we control, you know, how do we make a difference? What's the incremental work that we can be doing to kind of lead towards what could be transformational down the road? And again, that's not for everybody. And I think a lot of people are just, you know, I mean, if their response to this is to be checked out, that's completely fair. If their response, I mean, whatever, you know, I mean, everybody's approaching this from, you know, whatever place they need to come from, you know, but I just loved, and I know everyone participating today loved hearing your perspective, and can't wait for you to be back on the road when it's safe, and when it feels right, and when the ticket price is appropriate, and all those things are. I don't want to see the Antibalas show where it's $300 a ticket and it's me and 79 people who are paying $300 a ticket. I'll just leave it at that. So, so we're going to wrap again today's program, and again, huge thanks to all of our guests for sharing their really remarkable work and their vision and their passion. Huge thanks as always to Alexander Dolvin for producing the program. The YouTube link will be going up this weekend. So if you enjoyed this interview and want to share it, you know, please share it with your friends or post on your socials. We'll be back next Friday with another edition of Music Cities Together Live. Hit us up with questions, ideas, suggestions, thoughts at musicpolicyforum@gmail.com. And I hope everybody has a safe and pleasant weekend. Peace, everybody. Thank you.